Want to say hi to everyone. Welcome to my channel. I just wanted to stop in and say hi to everyone, and also I'm trying to get this thing to flash the sunlight. Okay, I guess that's better. But give an update on the surgery that I had on my hand, the CMC arthroplasty that was done, which means I was having problems moving my thumb around on my left hand, and pain here and pain here. And I mean, it would be so painful to the point I would try to grip stuff and would drop it because I couldn't, grip it like I needed to grip it with the right hand, like I do anything trying to grip with the left hand. It still hurts like sometimes, but there are less pain. It's like the more I try to use it, if I overuse it, it will start hurting. Like yesterday when I got up, I had no pain at all. But as the night grew, later on last night, I had a lot of pain. I mean, to the point I broke down and took some medicine so I could go to sleep. But I am also doing my own home therapy. So I could see if I could get anywhere with it by myself instead of going to a physical therapist. And I explained to my surgeon that if I did not get anywhere with it myself, then I would go to a physical therapist and do what needs to be done. I had my surgery on June 12th. So I want to say I'm a little over maybe 6 weeks. I'm about 6 weeks post-op from the surgery. Since I've had the surgery, which is on the left hand, the bone that was here was removed. And what they did was they took one of the tendons out my arm. Somehow they did it. I still have pain here. When I first had the surgery, all of this and stuff was bruised really bad. I mean, really bad. It was bruised. The first week I was in a half cast. The second week, actually 2 weeks after I was in a half cast. And then 2 weeks after that, I was placed in a full cast up to about maybe here on my arm. And my thumb, only this part of my thumb was exposed in the cast. I had pictures. I think I put a video up of my cast. But if you look closely, I got to turn it. Well, you can try to turn it where you can see it. If you look closely right here, this is the incision that was made. It's about 1 inch long. Yeah, about I want to say about 1 inch long. I have had no problems. The incision healed well. Like I said, the only thing that I did not like about it right after the surgery was the fact that I could not move my arm. So like if my arm fell out the sling, it would just drop. There was no feeling. I had to lift it by myself with the other hand. I couldn't move it at all for like almost the first 48 hours. I didn't like that. It freaked me out. I mean, to the point where I cried because I couldn't understand why I couldn't move my arm like that. But they gave me a nerve block during the surgery along with Twilight. So I was not put under general anesthesia, which was a good thing. But when that numbness wore off, it let me know that they had been in my hand. You can best believe that. It let you know. No problems. But the process of the healing has been pretty good, They told me it takes 4 to 6 months to heal. So, but they did not expect, when I went back to be taken out the cast fully, they did not expect me, and to be fitted for my brace, they did not expect me to be able to move my thumb like this. I mean, ever since it's been out, it tightens up from time to time. The brace they gave me that they had made for me, if I wear it now, somehow it stiffens the area. And so I have to take it out to do my therapy and stuff like that. And then I have to put it back on. But the brace has gotten so uncomfortable now to wear. It's like I think they need to refit me for one when I go back. And that will be in about another 2 weeks when I go back. So I will explain to them that they need to do another brace. If they don't want me in the brace or whatever the case may be, then I'll find out then. But otherwise, I will let them know that the brace doesn't fit anymore. So they're going to have to fit me for a new one. But because they make them right there in the office. So that's not a problem. What I will say, I'm still having problems with it being swollen, which is to be expected. This area is swollen. My first finger area and my second finger is swelled from time to time still, but it's still in the healing process. I'm only 6 weeks post-op, but I still cannot believe that I can do this and stuff without a whole bunch of pain, which is a blessing. And the surgeons that I had is awesome. They did a awesome job. Dr. Solomon, he's in Chevy Chase, Maryland. He did an awesome job. Oh my God, did he do an awesome job. His bedside manner off the bat is awesome. His staff is awesome. Very friendly. I love the staff. I mean, I would recommend this office and this surgeon to anybody because they're good at what they do. The physical therapy place that they recommended me to also is an awesome therapy place. The staff was friendly. They made you feel like they care. You know, you can go into some doctor's office and people have crazy attitudes. You'd be like, gosh, what's going on? And that is something that would make me not want to see a doctor. If the staff is not friendly, and if I get to that doctor and that doctor doesn't have a friendly bedside manner, you've lost me. I will not be back, and I'll let you know that I'm not coming back because I don't feel comfortable. Not enough for you to do anything to me. So then that's one thing that I advise that doctors have is a great bedside manner to make that patient feel comfortable for them to let you do whatever you do. Some doctors out there so arrogant, they're good at what they do, but they're arrogant and their bedside manner stinks. So you don't want to be bothered with them. It doesn't make you feel comfortable for them to do anything. And I'm just that type. You got a messed up bedside manner, you won't see me again. I'll let you know straight out. That's just me. Because I've had so much done. But I've had so much done by the same doctors, especially in my back. I've had 27 back surgeries. I've had a neurostimulator implanted in my back, and it malfunctioned and was recalled while it was in me. And it got so bad that they revised it that we couldn't even cut it on. That's how bad it messed up the nerves in my right side of my rib cage area. And it left me, even though I had it removed, it left me with this thing called intercostal neuralgia, which is a pain that will make you want to just go ahead and shoot yourself and get it over with because you don't want to feel it. It's as if somebody has a knife and they're turning that joint into your rib area and it's making it hard for you to breathe. You don't want to breathe. You don't want to move. You don't even want to cry. When you sniffle, when you cry, it hurts to inhale, period, or move anything, period, in that area. So you don't want to really deal with that, you know. Along with I have sacroiliac. The sacroiliac joint is messed up to the point I had to have radio frequencies done. It helped, but it doesn't totally take it away. So there's a lot that I have going on, and I'm here to educate people because of what I went through. And maybe there's someone out there that has been through some of the things that I've been through, and they want to know what has helped me and what hasn't helped me. But back to the hand, I got a little off of what I was saying. But the hand, it's been doing well since I've had the surgery. Not only that, my faith in God, I trust God, and I'm learning to trust Him more. I am a big believer in Christ. I can't tell anybody that I'm not because I am. I know who He is, and I know what has been done in my life through Him. So This video, like I said, is to educate people and to help someone else, like I said. The brace that I talked about, hold on 1 second, let me grab it. Well, anyway. Whew. Okay, there is a, can you see me? Okay, this is the brace that was especially made for my hand. This is the inside of it, and this is where the thumb goes in. Look. This is where the thumb of it goes in right here. I don't know if you can see it well, but this is what it looks like. And they place your hand in like the sock material, and it covers your thumb, and then the thumb goes in here, and the brace wraps like this. And this is the brace that they've given me for this. The lighting is crazy in here. It's seriously crazy in here. But this is the brace, and I wanted to just kind of show you how the brace works and how it fits or whatever. But as I said before, it's not swollen now, so the brace is pretty okay because my hand is not swollen. But like as the day goes, and if I use my hand, it starts to swell. So that's why they want you to wear the brace, except when you're doing therapy and stuff. Like I said, I still have pain. Sometimes it's bad. Sometimes I don't have any at all. And which is better than all the time, period. So, if you have any questions, comment down below on this video. Explain some of the things that you've been through, or if you've had this surgery on your hand and how your hand or your thumb or whatever is doing. Like this video, please. Trying to get more viewers, and I need this because I think people need to be educated on these things and stuff like that when it comes to orthopedic, because a lot of people out here have things done and they don't heal from it. You know, your mind's for set. Keep strong people around you when you go through things like this, because if you don't, you can fall into a depression. And I've been there and I've done that. The only thing that helped me come out was I had strong people around me and able to bring me out of the depression that I was going through. And so I have my family. I have my youngest daughter. I have my son. I had my oldest daughter. My youngest daughter has been the one that has really been there and stepped out and knew what to do, because she was living with me at the time, her and my son. And, you know, my ex. And so, you know, like I said, you got to keep strong people around you. I have my godmother and, you know, my god sisters, and they're more like sisters to me. I'm very close to, and God will place people in your life just for that reason, I believe. And so, like I said, hit this subscribe button, like the video. Whatever questions you have, yes, put them in the comment section and I can answer the questions for you. Or if you've done a treatment out there that has helped you with that, comment. let me know what treatments have worked for you. Also, I'm a person with failed back surgery syndrome. I have radiculopathy. I also have degenerative disc disease. I have a cage and rods and screws in my back. I've had 3 fusions done. One at the L5S1, and they had to remove the hardware that I had at L5S1 because instead of it fusing and going away from the spinal cord, it was going in the direction of the spinal cord. So they removed the hardware out, and since then it's been okay. I still have a lot of pain. It still affects my legs. I've had 4 knee surgeries, 3 on the left knee. My left knee is total replaced. My right knee is partially. There was things that I went through with the left knee. Oh, God, that was like the first surgery I had. It was like a surgery from hell. I don't know what happened, but yeah, it was a lot going on when I had that first surgery. I have to get into that another day because I don't want this video to be too long. But as I said before, like, subscribe. I'm also a singer. If there's something out there that you want me to sing, if I know it, I have no problems. I will sing it. Let me know. But just wanted to give you heads up and give you an update on what's what with the hand after the hand surgery. Like I said, I'm able to move my hand, my thumb and stuff, and without a lot of pain or any pain some days. So that's a good thing. So have a good weekend, and may God bless you. Like I said, hit the like button, hit the subscribe button. You're new to my channel. Thank you for joining. Come on in and join me and join the family. Eventually you'll meet my family later on in other videos. And we'll talk soon. Have a good one.